Hospital Association, which is hosting today's Zoom call and press conference. Jill?
Hi, my name is Greg Bell. Pardon me. My name is Greg Bell. I'm the president and CEO of the Utah Hospital Association, and we welcome you all here today. We have assembled experts from our 4 hospital systems in the state of Utah, and we welcome the media and other friends to our occasion today. Thanks to all for your contribution in organizing this event, and thanks to the media for attending. Everyone will be muted except for designated presenters. And for the media, kindly use the chat function you'll see at the bottom to submit questions, and we'll follow up on your Q&A at the end of the presentations. The reason we're here today is because of the very disturbing uptick in COVID positive cases in the state of Utah. Since May 28th, we've had a steady incline in cases, averaging more around 400 cases per day, which is far above what we saw in previous weeks and months. We even exceeded the 600 mark. And while you have to look at the smoothed average, the trend is definitely up, and it shows no sign of abating. And today we want to present to you what Utah's healthcare systems and professionals recommend, so that we can, as a state, come together and do all we possibly can as a citizenry to interrupt this vicious increase on this pandemic. We want to introduce our hashtag of MaskUpUtah, and we'll share that with you. Joe, would you like me to do that now, or we're doing the graphics later? Okay. So let me introduce our clinical leaders, and thanks to you, and also our infectious disease and emergency medicine experts, who will answer questions and make presentations that will indicate to you what's going on. First of all, from Mountain Star Healthcare, we have Chief Medical Officer Dr. Michael Bauman and his associate, Dr. Jeremy Voros, emergency medicine physician. So let's turn the time to Mountain Star. Dr. Bauman.
So Greg, thank you very much. And thank you to the Utah Hospital Association for organizing this event today. We're very appreciative of that, and for my other colleagues from the other health systems joining today. I want to make sure that those who are listening today really understand the serious nature of what we're here about today. Greg mentioned that to you around the increase in COVID. I have insight into 21 other states and 40 other markets. And unfortunately, Utah is a lot like our other markets. We're seeing an increase in this issue around COVID. And it's multifactorial, at least in Utah. In part, it's due to the decreasing social distancing that we should be following. It's the events around the Memorial Day holiday. Any number of things are causing this. And what we're here to talk about today are basics. What are the basics that we should be following? You're probably tired of hearing this, but it's, social distancing, 6 feet away from one another. It's remaining home as much as possible to enable that social distancing. Hand hygiene, one of those really basics that we all should have learned as a kid. And today, what we're really focusing on is masking. And masking is a key initiative, but all of these together are important for all of us to prevent the spread of this potential problem, even worse than it's occurring today in Utah. And it's particularly important for those that are actually at higher risk, those that are older and have multiple medical problems, for example. Unfortunately, I fall into that group right now, and luckily Jeremy over here has got his mask on for me. So today, let's focus on masking and clarifying. What is masking about? Masking is not about you. Masking is about everybody around you. This is to prevent the spread of potential COVID from you to someone else. That's the key to remember. Also, I want to touch on something. As a clinician, I've been a pulmonary critical care doc for more than 30 years. This is a healthcare issue. This should not be a political issue. Masking is about basic healthcare and preventing the spread of disease to your family, friends, and even people you don't know. Now, one of the problems that we run into with the data around masking, and I took some time yesterday reviewing that, and what I found is it's got a lot of if, ands, or buts. We don't necessarily have all the data we need around masking, but this is really a common sense issue. Now, in medicine, we always like something called a randomized controlled trial. That's the gold standard. So let me give you an example. In the British Medical Journal, in 2003, there was a great article, and it was all about, I want you to listen closely, do we need to do a study about wearing parachutes when we jump out of airplanes? This is called common sense, guys. We need to be doing what we need with masking to prevent spread. We would like more data, but what we don't have is the time to wait for that data. This is very common sense. We need to be doing it now, again, for the protection of others around us. So I'd end with mask up, do the right thing, and help us flatten the curve again and reduce the issue of COVID, not only here in Utah, but around the nation. So mask up. Thank you.
Okay, we have Dr. Arlen Jarrett, Chief Medical Officer of Steward Healthcare. Dr. Bauman, or Dr. Jarrett, you're muted somehow.
Can you hear me now?
Yes, thank you.
Okay. Thanks, Greg. I'm pleased to represent the Steward Healthcare System in Utah, our 5 hospitals, as well as health centers and clinics and offices. And as you know, we're part of a larger national system from which we have learned a great deal. Our hospitals in Massachusetts have been through the pandemic crisis already once, and as they're settling down and starting to gain some calmness in their hospitals, we have concerns that in Utah that we might be ramping up and heading possibly to the same place where they have been. I'm pleased to report that right now the Steward hospitals are only at 50% capacity, so we have plenty of space right now. Over the last few months, we've had an opportunity to build up our supply chains, and we have strong supply chains, and we've honed our infection control practices, which were already strong and robust. But based on things that we've learned in Massachusetts and elsewhere, we have really strong infection control practices that we have in operation. And as Dr. Bauman said, one of the key principles to our in-hospital infection control practices has been the universal masking, where everyone wears a face mask. We've done an excellent job inside our hospitals at preventing the spread of COVID. It's extremely rare for people to actually catch COVID inside the hospital. And a big portion of this is because of the PPE we wear and the masking that goes on. There are a few studies starting to surface. There was one preliminary report out of the University of Iowa last week that looked at all the different states in the United States and compared spread rate versus those states that actually had a universal masking protocol or recommendation or guidance. And there's a very strong correlation between those who are masking and have lower rates versus those who aren't masking and have rates that are getting out of control. Since the beginning of the pandemic at Steward, we've had a steady influx of COVID patients to our hospitals, especially those in the west side of Salt Lake County. And we've had a lot of awesome experience, a lot of awesome people, patients and their families. We've had just amazing experiences. We've seen amazing recoveries, and we've wept with those few sad losses. But fortunately, we've just seen most of our people get better and leave, go back to their families. Our staff, our doctors, our nurses, and others have spent a great deal of energy building these relationships and in these relationships. It takes a great toll on healthcare providers to be in these experiences. But I will also say that our healthcare providers have gained great strength, the type of strength that people gain from the love that one feels when they provide meaningful service to others. and that's what charges our batteries. That's what keeps us going. And but we know we have a lot of work to do ahead of us. We are concerned. Stuart is concerned about the trending upwards. Ever since Memorial Day, we've seen our hospitalization rate go up. Our case rate has grown up. We're now 9th in the nation, where we were boasting a very low case rate before. Now we're 9th in the nation. We were 7th yesterday. The good news is from these data is that for whatever variety of reasons in Utah, the people who die from the COVID disease is actually a pretty low rate. In fact, we are the lowest state or region. We're number 51 in the country for a death rate, right around 1% or less. We'll be studying this to figure out what are all the factors that go into this. I'm sure our younger, healthier population has something to do with this, but I also like to think that the excellent health care that our citizens get when they come to our hospitals has a lot to do with this, or something to do with it at least. We know, though, that we can't keep going the direction we're going. We've got to do something, and Stuart fully supports the measures, this MaskUpUtah program. And I just want to mention one more thing from our data, and then I'll send it back to you, Greg. But as I look at the data, the state data, just during the past week or two, it's clear that 60% of cases were spread through the household. That means 60% of people who catch COVID disease catch it at home. Now, how does it get into the home? We find that about the other 40% is coming mostly from social contacts and other contacts, a little bit of work contacts, but not so much as you'd think. It's mostly from social and other contacts, and we know that that we've got to do something out there while we're in society to protect our families. We've shown that we could do this once before with some very drastic lockdown measures, but I feel quite certain that we can do this, and I'm optimistic that we can do this without those lockdown measures if we will all just take our responsibility and practice those things that are being preached here today and over again about making sure that we social distance and that we use good hand washing and sanitizing, and that when we can't social distance, that we wear a mask. At Stewart, we're encouraging our employees and our staff to set examples as healthcare workers by wearing their mask and practicing social distancing and good hand hygiene while they're out in public. We feel that this can carry a lot of weight when people watch them as healthcare workers. They might also be inspired. And I'll just end on saying that really there are a lot of reasons we can think of to wear a mask. But it boils down to this: we're protecting our own families. We're protecting the people that live inside of our home. And it's as simple as that. Back to you, Greg.
Thank you, Dr. Jarrett. We'll now go to Dr. Mark Briesacker, Chief Physician Executive of Intermountain Healthcare, and he's joined at the table with Dr. Eddie Tinium. Welcome. Go ahead, Mark.
Thank you, Greg. And it's really great to be here today. I'm proud that Intermountain is joining with the other health systems in Utah to talk about this really important topic. Why is this so important? You know, this is about all of us. This is about our patients. It's about our caregivers, and it's about our communities. And we're at this really important moment in time. We had a tremendous response at the beginning, and in many ways, we were setting the bar across the nation with how we responded, how we came together, how we quickly developed the necessary protective equipment to be ready for whatever came next, and how we prepared for any and all scenarios going forward. We then were able to begin to open up, and that's been really good as well, and that's meant a lot to people. In order to sustain this, I think that we have to take the steps that we've talked about here. This is about caring for each other and taking that individual step to say, I'm doing this for you. From a perspective of maybe other things we do like this, every day we get into our cars and we put on our seat belts, and we drive through and we follow guidelines and rules and regulations, and we're thoughtful for in that way, because that helps keep you safe, and it helps keeps me safe and keeps my family safe. And so in many ways, I think this mask is just another seatbelt that we need to put on every day. Now, another example of our great response in the community has been the support we've gotten to make homemade masks. And so this is the mask I wear a lot. It's kind of gray and businesslike, but I also like to have fun. And my friends gave us this great mask that has some tractors on it. And as a pediatrician, of course, I really like this one, which is to have a lot of fun with the polka dots. And so there's a mask for every moment, and this is our time really to wear that mask in every moment. I also want to talk, in speaking about leadership, I really appreciated the leadership from our state epidemiologist, Dr. Angela Dunn, and the Utah Department of Health. The way that they have worked with all of us to coordinate, the partnership that they have demonstrated, and that thought leadership and expertise that they have brought to this conversation and guidance is really important. And we're thankful to have that type of partnership with Dr. Dunn and with the Department of Health. And I'll just come back to this idea that we can and must continue to lead out on this important topic. Masking up, Mask Up Utah is a simple yet extraordinarily important idea. It is that seatbelt that we all have an opportunity to put on every day. We do it for ourselves, our friends, our family. For us, it's for our patients and healthcare workers. And that's the type of simple step that can make a real difference. Now, we'll talk a little bit later about the steady increase in hospital admissions and intensive care unit admissions that we have seen. We, like the other health systems, have prepared. We're ready for this, and we need your help. And so I really appreciate the time today, Greg. Again, I want to thank my colleagues, because I think our collective voices can and will make a difference here. And back to you.
Thank you, Mark. Let's go now to the University of Utah. Dr. Michael Good, Chief Executive Officer of the University of Utah Health and Dean of the University of Utah Medical School. He's joined by his colleague, Dr. Jean Marie Meyer, from whom we'll hear later. Thank you, Dr. Good.
Good afternoon. I'm Dr. Michael Good, CEO of University of Utah Health. Coronavirus is turning out to be an extremely tough virus. Coronavirus can move fairly easily from my mouth and nose to your mouth and nose. It only takes a cough or a sneeze, and from there, it moves to your throat. For many, coronavirus infection is a mild condition, a sore throat, a cough. It might be no symptoms at all. But for some, coronavirus makes its way from the throat into the lungs, and once in the lungs, coronavirus can cause an extreme infection, in some individuals leading to severe pneumonias and even death. Right now, coronavirus is moving too fast in our Utah communities. It's a tough virus, and it is very fast. We need to slow it down, and we need to slow it down now. We need to stop giving one another coronavirus infections. So today, I join my colleagues in asking you to hit the brakes on COVID. I'm asking you to do this by wearing a face mask whenever you're outside of the home. Whenever you're outside of your home, wear a face mask and stay distant from others. That's how we hit the brakes on COVID. Face coverings and distance are our best weapons to fight coronavirus. You know, most of the decisions we make in life, good or bad, they primarily affect our own lives. If we choose to smoke cigarettes, we run the risk of developing cancer in our own lungs. We choose the behavior, and we individually bear the consequence. But with coronavirus, for most of us, when we make decisions about our own individual behavior, we're making decisions that are primarily going to affect others. If we make poor decisions, we will hurt others. If we do not wear face coverings, we will hurt others by potentially sharing and infecting them with coronavirus. So again, today, I'm asking you, let's hit the brakes on COVID. Please wear a face covering, not just for yourself, but to make sure you are not spreading the virus to others, to make sure you do not infect your mom, your dad, your grandma, your grandpa, your close friends, your colleagues. Wear a face covering because you care about others. Wear a face covering because you're worried about your own health. Wear a face covering so you can keep your job or get back to work sooner. Wear a face covering so we can all enjoy as many normal activities in life as possible. With coronavirus, the life you save with a face covering and distance may not be your own, but will be the life of a family member, a friend, or a colleague at work. Thank you for helping us hit the brakes on COVID with face coverings and distance. We can do this. Let's mask up, Utah.
Thank you, Dr. Good. For our final presenter, we've invited Dr. Eddie Tinium, a specialist in infectious disease. He's going to tell us the clinical benefits of wearing a mask, how we can protect others, and why it's important to stem the spread of COVID. Doctor.
Yeah, thanks, Eric. Thanks for having us. And it's really great to see all the healthcare leaders coming together and collaborating on really just one of the hardest healthcare crises we've had in recent past. We are seeing a disturbing and quite frankly, an alarming trend in an increase in COVID cases. Really, since May 27th, we've seen increases in cases throughout the state. This isn't isolated to a single outbreak. We are seeing increases throughout the entire state of Utah. In addition, our testing has plateaued. And so this is not a phenomenon from an increase in amount of testing. This is true increase in community-based transmission. In addition, across Intermountain Healthcare and across all of our healthcare networks, we're seeing increases in hospitalizations due to COVID-19. Within Intermountain Healthcare, compared to a month ago, we have doubled our COVID-19 cases in our hospitals. We currently have the capacity right now to care for these patients and offer them advanced therapeutics. But if we continue this trend and we do not abate the crisis that is going on now, we will reach capacity in the coming weeks, and we will no longer be able to care appropriately for patients with COVID-19 and also those that seek care for other reasons. In addition, the Utah Department of Health reported that the number of close contacts that each COVID-19 case has increased from 5 to 20 as of recently. That is really an indication that we as a community are no longer following social isolation. We're moving around the community. Our cases of COVID-19 now have certainly more contact with other people, which makes contact tracing hard and more laborious. In order to prevent a significant healthcare crisis, we must course correct now. And we have to be aggressive with this, and we need to be bold with this. Everyone now has a role to play to protect themselves, their families, and their communities from COVID-19. 3 steps that we need to focus on. The first is why we're here today. We need to mask up. We know that a significant proportion of the transmission of COVID-19 occurs from people that are asymptomatic or minimally symptomatic. These people will be out in the community, engaged in grocery stores and other social areas. These people are inadvertently transmitting the virus. When we put a face covering on, we reduce the amount of infectious particles that are leaving our mouths, our nose, and reaching those others, infecting those others, causing those others to get sick, and in some cases die. By putting on a face covering, we are protecting other people. We're protecting us in terms of preventing infections in our communities and our families. This is an imperative. If you have to leave the house and you are in public, we need everybody to wear a mask to really stem the tide of this epidemic. In addition, we can't forget the basic principles of preventing COVID-19. We must maintain social distancing. We must reduce the number of close contacts that we have in our day-to-day activity. We need to really reduce the amount of time that we spend out of our homes. And if we do have to spend times out of our homes, at work, at grocery stores, that we need to mask up. And the last thing that we really need to focus on and continue to focus on is hand hygiene and preventing touching our face, nose, and eyes in order to prevent that transmission to ourselves. The time is now. If we are going to course correct and prevent a healthcare catastrophe from getting worse, to prevent us reaching our max capacity, we have to be bold right now, and that includes having everyone mask up across the state of Utah. Back to you, Greg. Thank you.
Thank you, Doctor. We'd like to show you the graphics that you're going to see. So this woman is going to wear her mask in Mask Up Utah. I do it for my mom. This woman will do it for her kids. And this young man will do it for his friends. These visuals you will see throughout the state of Utah on billboards. You'll see them on Twitter, Facebook, Instagram, and other social media platforms. You'll see them on landing pages and in digital media. You'll hear them on radio, in ads and talk shows, and you'll probably, we hope, run into them as your employer tries to pass the message and will enlist you to pass the message to your friends on your social media platforms, to your family, so that we can multiply the influence of the people who have been won over to this. This has to be a non-governmental initiative. When government gets involved, it gets political. This is not a political issue. We can do this as a community. If we want to keep our economy open, we need to do this for someone. And I choose to do this for my family. I mask up for my family. Dr. Good.
Thanks, Greg. I'm going to mask up for all those who helped me at the grocery store and the hardware store and other retail establishments when I'm in their stores. I mask up for them.
Dr. Boros.
Like Dr. Good, I mask up for all those other essential workers who, like our hospital staff, have to go to work, who are serving our community, who need to be there to make sure things run smoothly. I mask up for the essential workers in our community.
Dr. Jarrett.
I'll mask up to keep my family safe.
Dr. Briesacker.
I mask up for family, friends, and for all the caregivers at Intermountain. We'll be there for you.
Thank you. We would now like to entertain questions from the media. Alex Cabrero says, wearing a face mask shouldn't be political. Do you feel wearing one should be made mandatory by political leaders with some type of penalty for those who don't? Why don't we ask Dr. Jarrett that question?
Well, I wouldn't be in favor of penalties, I don't think. I think I'd like to think that we can do this on our own, as has been suggested, without this being mandatory. I would save any sort of government mandate as the last-ditch effort to protect us from ourselves.
Thank you. David Boy asks, I've heard a lot of people say I can't wear a face mask due to a medical condition. Are there common conditions that prohibit wearing a face mask in public, Dr. Breezacher?
You know, there are some respiratory conditions that certainly could come into play. I think that most people who have these types of conditions are very high risk to begin with. And so I hope and trust that they are taking steps to stay safe, protect themselves, and their friends and families around them are doing so as well. You know, I think that for those, wearing a mask is something that takes a little bit of time to get used to. It can be a bit uncomfortable and feel a bit constricting. And my ask of everyone would be to wear the mask, stick with it, and you will find over time that you do accommodate and your body adjusts to wearing it. So a few conditions, rare conditions at best, and for most, absolutely for the overwhelming majority of us, we can do this together.
Okay, thank you. We have a question from Carter Williams. And this will be for one of our infectious disease specialists. What message would you give to people who say they don't make a difference? What are the numbers behind how much masks reduce the spread? I don't know if Dr. Jean Marie Williams would take that, or Dr. Stenham. Dr. Williams, would you take that?
I can take that. So I think we all can make a difference in terms of wearing our mask or face covering. Studies have shown that we can significantly reduce the transmission to other individuals. So we can each all do our part. And I think has been mentioned before that since COVID-19 can be spread or individuals can be infectious without our knowing it, we could have mild symptoms or be asymptomatic or start shedding high amounts of virus before we know. It's most critical that all of us wear our mask when we're around other individuals.
Anyone else like to address that one?
I agree with Dr. Mayer. I think something that can really highlight the utility of wearing masks was a report in the media that came out a number of weeks ago where there was 2 infected hairstylists, and they worked at a hairstyle salon that required masking of both the individual people working that were infected and all of their customers. There's over 150 people exposed to those 2 people that were infectious, and 0 have gotten COVID-19. So it really just shows how beneficial a mask can be when worn in social environments like that. We're going to see more and more examples of this come out in the media as our medical literature catches up with all this. And so it's absolutely clear that wearing a mask is preventative and will definitely save lives.
Thank you. I called you Dr. Williams. I apologize, Dr. Mayer. We also have with us today Dr. Michelle Matau, infectious disease physician and Spanish-speaking subject matter expert, and Dr. Carlos Gomez, infection disease specialist at the University of Utah, and we'll try to direct some questions their way. Paul Nielsen says, what are some of the reasons people resist wearing masks, and how would you debunk those reasons? I wonder if Dr. Gomez, are you there?
Hey, Greg, we're going to do the Spanish-speaking portion of the press conference after the Q&A.
Okay. All right, great. Well, then let's direct that to, I'll pronounce your name correctly this time. Dr. Meyer, why don't you address that? How would you debunk reasons people give for not wearing masks?
You know, it's hard for me to know all the reasons that people prefer not to wear a mask. I think some of it was the people brought up sort of earlier that it might be uncomfortable, or people may feel constricted. That again, that just practice wearing the mask can be helpful. I think there may have been mixed messages earlier in the COVID pandemic, where there were mixed messages coming out from different organizations. Some of that was due to a surge on masks and supply, and the concern that those healthcare workers would, to conserve the supplies for healthcare workers. We've learned a lot about COVID and transmission, and I think a lot of information has come out about asymptomatic transmission and transmission when people are pre-symptomatic. So it's become more evident that it's really important for everyone to wear a mask and to just continue reinforcing that.
Thank you. Dr. Voros, there's a question here of saying, why is this political and how can we make it not political?
I can't answer why it's political. As a physician, it's pretty straightforward. The data show that wearing a mask reduces the spread. People come into the emergency room and are understandably nervous about potentially getting COVID while at the hospital, and they're happy to wear a mask at that time. And I would say that being out in the community is a similar situation. So I think it's common sense, as Dr. Baumann mentioned in his statement and others have said today. It's about protecting yourself and your community, and that politics doesn't seem to play into it from where I sit in the emergency department.
Thank you. Dr. Briesacker, perhaps you could answer, if COVID cases are increasing, why are we still seeing about a 40% available capacity in our ICU beds and our other hospital beds?
So the answer to that, Greg, and it's a great question, is, and I think we were just maybe pointing to the facts, we have increased in the number of ICU beds that are used every day, the number of ventilators that are used every day. While the increase in hospital utilization hasn't been as fast as the increase in total positive cases in the community, those positive cases are the leading edge of what then follows several weeks later. A few weeks ago, we were all responding to the outbreak in places of work at the meat, like for example, at the meatpacking plant up in Logan. And we know that that was just the first step, with workers getting COVID-19, then family and friends contracting the disease, and then that leading to broader community spread. And sooner or later, that spread gets to a high-risk patient. And those are then the patients that end up in hospitals and end up in our intensive care units. And some of them, very sadly, end up passing away from it. And that's why we're all here today. It really is that collective thing that we can do together, this very straightforward step of washing hands, keeping that distance, wearing a mask. And so if we don't act now, to the point that Dr. Good made, Dr. Tinium made, and everyone on the panel made, we will then be in a place where there is increasing pressure on these hospital beds. And that's not what we want. And I know as a community, we can do this.
Okay, Melissa Anderson asks, I notice everyone's wearing a different type of face mask. How effective are the various masks? And how many feet do you have to be away from someone when you're wearing a mask? Very good question. Let's go to, let's see, Dr. Good, why don't you take that one?
Thank you. I always go back to the principles, which I tried to illustrate or describe earlier. Remember, the virus spreads in respiratory secretions. And so anything that can slow down or separate two people so that respiratory secretions from an individual with coronavirus do not make it onto the hands or the mouth or the nose of another individual, and hence that second person becomes infected, help us slow down the virus. Turns out most of us, when we cough or sneeze, we expel respiratory secretions for approximately 3 feet. It turns out the Olympic sneezers and the Olympic coughers can sometimes have respiratory secretions approaching 6 feet. And so we set that distancing, that physical distancing recommendation at 6 feet, hopefully to keep us, we believe, to keep us apart so that when we're near someone who sneezes or coughs, and as Dr. Mayer said, may not realize they have coronavirus and coronavirus in their respiratory secretions. If we stay apart, those respiratory secretions cannot move from one to another. If we add a mask, we slow down the respiratory secretions. The question about different types of masks, different types of face coverings, all of them slow down respiratory secretions. I don't know, I've been wearing my mask for several weeks. I've got a little bit of seasonal allergy, and I had a pretty good sneeze the other day. And I can tell you, most of the respiratory secretions landed in the mask, not in the environment around me. That's what we're trying to do. So any face covering is better than no face covering. In the hospital setting, where we have COVID patients, we use medical grade masks. Like Dr. Briesacker, I thank the Project Protect and the many thousands of volunteers who, as part of the Project Protect, made 5 million masks for our community out of medical grade materials. So any mask is better, any face covering is better than no face covering. Medical grade masks are better than non-medical grade masks. But I think if we get everybody in a face covering, we will start to see the progress that we need in slowing down this virus.
Dr. Voros, address children wearing masks. We're trying to send our children back to school and students to college. What about younger people and children wearing masks? Some parents cite CO2 buildup and dangers.
I've seen that on my social media feeds as well, people expressing some concern about that. Medical professionals, especially surgeons who sometimes do 6, 8, 12-hour surgical cases, have been wearing masks for extended periods of time without any trouble. So I'm not sure where that rumor started or what people are concerned about there, but there, we have more than decades of experience showing that it's safe to wear a mask for a very extended period of time. As far as children wearing a mask, their risk is similar to adults in terms of contracting the disease. Their illness severity seems to be lower, but a child can spread it. In fact, a child is probably a more efficient spreader of coronavirus than an adult would be if they had the illness. But part of the reason I think that wearing a mask is difficult for people to wrap their head around is because one individual's chance of contracting coronavirus is fairly low. The mask is meant to reduce that risk further. If you're talking about a population, then you start to add those risks together. So if you can get an entire schoolroom of children to wear a mask, you've collectively reduced the overall risk of coronavirus being spread among that group and taken to those children's homes. You've suppressed that risk significantly. So it's about this cumulative effect. I think that, whether or not children are going to be required to wear a mask is sort of beyond my call as an emergency physician, but it certainly seems like a tool that we have available to us to help reduce the spread, to help return to more normal activities, and to flatten the curve and decrease the case count. So I think it's vital, important, and certainly something that we should be considering for adults and children.
Thank you, Doctor. Let's close with 2 final questions. Dr. Briesacker first, and then finally Dr. Jarrett. Dr. Jarrett, will ask you to address what precautions we should take as we approach the 4th of July so that we don't have a similar spread as we saw on Memorial Day. Dr. Briesacker, the question is about when will Overwhelm ICU capacity? We seem to have good capacity today, but given the growth of the infection spread, what's being modeled?
So based on our current growth in hospital cases and ICU admissions, our models are showing that in the next 4 to 6 weeks, we will be approaching our peak conventional capacity. As I mentioned previously, we have planned for additional contingencies and and so we're ready to do that. But we don't want to. We want to manage this across our healthcare systems within the conventional beds and ICU beds that have been staffed with experienced nurses and experienced respiratory therapists and experienced physicians. So we're ready for whatever comes. And that being said, we must take these steps. We must work together, each of us making that choice to wear the mask. Mask Up Utah is definitely a very important thing for all of us to be strongly considering today.
Thank you. Dr. Jarrett, let's have you close out.
Sure, your question about being safe on the 4th of July. Well, first of all, don't burn yourself, don't burn others, and don't burn down any buildings. That's my first big advice. But in terms of the subject at hand, wearing the mask is clearly the key thing for us all to do when we can't keep more than 6 feet away from each other. We need to be wearing a mask so that we don't spread this disease. There's been a lot said about different types of masks. Sure, some masks may be better than others at preventing spread, but they're all good. Medical masks do something different, especially the high-grade medical masks that the clinicians wear when they're taking care of COVID patients. Those masks are designed to prevent viral particles from coming in. Most masks that the public are going to be wearing are doing less to prevent viral particles from coming in, though they do some of that. They're mostly preventing us from spreading viral particles outwardly. There is somewhat of a trend sometimes for people to wear a mask maybe part way. Maybe they wear it across their mouth but not across their nose. And while this may be better than no mask at all, it still is way less than optimal, because we have actual scientific studies and slow motion studies showing what kinds of particles come out of our nose and our mouth when we're wearing masks, and a significant amount will be coming out of our face if we're not wearing the mask properly. And I'll just end with just some data. People have been asking for data to show that masks help. I know that sometimes it feels like it might be an infringement upon our freedom if we feel like people are telling us we must do this, especially if we don't want to. But here's some data out of the University of Iowa study I referenced earlier. They looked at all of the states in the United States and looked at their rate of spread up until May 22nd, and they compared the states as to whether or not they had universal masking programs in the state or not. And if every state without a universal masking program had behaved like the states that did have universal masking programs, they calculate that up to May 22nd in the United States, we would have seen 450,000 fewer cases of COVID transmission, because the states where people are wearing masks have less spread of COVID disease. That's a fact. We're starting to get evidence to support that fact. And my plea, along with everyone else on this panel, is that we all should do our part to protect ourselves and our family and others around us. Back to you, Greg.
Thank you, Doctor. Thanks to all our participants. It's been a wonderful time together, and we trust the media will find us as newsworthy. We think it's something very, very important. Hospitals are doing this of their own initiative. I should mention that our rural facilities are joining in this campaign as well, and will be contributing. And so this is a statewide campaign of Utah's hospitals. We'll turn the time now over to our Spanish physicians and experts. Again, Dr. Michelle Matao, infectious disease physician, Spanish-speaking subject matter expert, and Dr. Carlos Gomez, infectious disease specialist at the University of Utah Health. Thanks to all our participants and to the media.
Hey, just a note on our Spanish-speaking media, we will be sitting Dr. Carlos Gomez and Dr. Michelle Matao now to answer your questions in Spanish. Also want to let all the participants know that this campaign will be carried out in both English and Spanish. So it'll appear in Spanish-speaking publications, Spanish-speaking media, and in Spanish-speaking billboards as well as English content as well. So let's go ahead and get our participants set, and we'll start out. Dr. Gomez, are you with us?